is for London. Do you support including transgender healthcare in HealthySF? Why or why not?
Including what?
Do you support including transgender healthcare in HealthySF? Why or why not?
Okay, yes, and because it's the right thing to do. Everyone deserves to have access to health care in any capacity. I mean, that's, as far as I'm concerned, a no-brainer in terms of the kind of support that anyone, a supervisor, I'm sure, would be happy to advocate for and support. Can I have a follow-up question?
I think what this question is really dealing with is medical, basically stuff, medical concerns that deal with the transsexual community as far as procedures that are not currently covered but that will be covered, yes. And whether the cost that it takes to do that is worth the cost, and that it's been shown most prevalently in Berkeley that the cost of that doesn't really make that much of an impact. So
I definitely support making sure that when someone needs access to health care, that they get access to health care, especially if it's in regards to saving someone's life or there's a medical condition, regardless of the age, the gender, or anything else. It's important that we all have access to affordable, safe health care that helps to preserve and take care of our lives. Oh, is it working? Is it working? Yeah. Can you hear me? Can you hear me now? Yes. Turn me up, Mike. Turn me up. Turn me up. There we go. Okay. Did you guys hear my answer? Yes, of course. I mean, can I have something a little bit more hard?
Gender reassignment procedures. Do you support that? Taxpayer-funded gender reassignment procedures?
Yes, and that San Francisco actually has. Am I speaking about the right thing right now? Okay, so I mean, of course, yes.
And just another maybe different spin on it. What do you think of restaurants in D5 that are itemizing out HealthySF charges on the bills?
Don't get me started, okay? I know that it's something, I mean, I do, like I said, I'm happy that people that are my friends who didn't have access to health care. I pay for health care for all my employees. It's really expensive for a small nonprofit, but I believe it's important, and although we're not required by law to do so, I just think it's something we have to do, but I really don't think on our receipts that it should be itemized. Just absorb it somewhere and take care of it on your own, but I don't want to look like I'm getting taxed to death on a bill where I'm trying to enjoy my meal. And healthy tax, should I have ate those French fries? I mean, really? I mean, yeah, I'd like it to be absorbed somewhere in the bill. Any other harder questions?
What's the question you wish we had asked you?
Oh, okay, thank you. The question, one of the things that you had mentioned is, do I support centers where there are safe injection places for those who, and that's one of the questions that is near and dear to me, because I had a sister who was addicted to drugs who had to call me in the middle of the night, and I couldn't say, well, wait, you know, I'll get you help in the morning. She needed help right then and there. She needed access to things that I did not have access to, and it was extremely difficult. And I think either having access to places that are safe, but also having easier access to places where there are treatment options, because those sometimes are not easily accessible to people. And sadly, you know, I lost my sister to a drug overdose, and I think that if we make things better in San Francisco in terms of having access to get help easier for those who are addicted to drugs or alcohol or anything else, then we can create a better city. We can create, you know, people who are, you know, clean and sober rather than people who don't have access to things like that. So that's the question I wish I would have had. Thanks. And I'll yield the microphone.